If you're preparing for your birth and you're wondering how can we speed this process up, and you're wondering what type of natural induction methods to start taking, in this video, we're going to be talking all about whether or not evening primrose oil can help to induce your labor. Welcome to the MamasteFit YouTube channel. In this video, we're going to be talking all about how you can use evening primrose oil and whether or not it is going to induce your labor. My name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. And I have personally used evening primrose oil only in my first pregnancy, and then I did it for the next 2, 3, however many. So I'm excited to share with what the evidence says about evening primrose oil.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3. And I have not used evening primrose oil personally, but we do recommend it to patients who are going to be induced in the future.
So first, let's discuss what is evening primrose oil. Usually you can get it in like a capsule form that just like kind of dissolves, and you can either take it orally or you can insert it vaginally. However, you could take all the oral evening primrose oil that you want, and it is not going to affect your cervix at all. You have to insert it vaginally in order for you to see any of the potential benefits of the evening primrose oil use. So Roxanne, what is evening primrose oil?
So evening primrose oil is, like as Gina said, a capsule that has this oil inside. And this oil is from the evening primrose plant, obviously. It's a very unique name.
I would have never guessed.
I know, would have never guessed. Well, sometimes it's like, this is from the dandelion flower. What do you mean? But this is from the evening primrose flower. But the oil that's extracted from the flower is almost like a derivative of prostaglandins. It's also used for like a bunch of other things, like you use it on your hemorrhoids and like some other like medical reasons they recommend evening primrose oil. But for labor, it is a derivative of prostaglandins. So prostaglandins is used to help ripen and soften your cervix. So that is why if you place this oil on the cervix, it's going to kind of help soften it. So the thought is that, yes, you can take this orally. It is not going to do the softening portion of the cervix if you take it orally, but you can do that. Some providers even recommend taking it orally, but research doesn't necessarily support that that's going to do much for you. Placing it vaginally and letting the capsule like dissolve and then the oil starts to work on the cervix has been shown to help increase your Bishop score. So what is the Bishop score? So Bishop score is a score out of 12 that they give you based off of different things. One of them being how dilated your cervix is, how soft is your cervix, where is your cervix located? Because during pregnancy, our cervix is located behind our baby's head, or posterior to the baby's head. And during labor, the cervix slowly moves forward to a more anterior position, or just in the front. And that is why if you get a cervical check during pregnancy, it's awful. And during labor, it's maybe still awful, but not as bad because they don't have to reach as far behind your baby's head because it's moved to the front. It's obviously a protective measure because you don't want things touching your cervix, but it's why the cervical checks are so uncomfortable during pregnancy. How thinned out your cervix, so the effacement of the cervix, and then where baby is within the pelvis. That's just not necessarily an indicator of when labor is going to happen. The Bishop score doesn't tell you when labor is going to happen, but it gives you like an idea of how ready your body is for labor and how likely it is that you either will, 1, go into labor on your own, or 2, if you have to be induced, how likely your induction will be successful, for a lack of a better word.
So there is research that supports that taking evening primrose oil vaginally could help to soften your cervix to prepare your body for birth. It is not necessarily going to start labor, though, or contractions, or induce your labor, but it's probably more similar to dates, where it's going to soften the cervix to make it more easily manipulated when contractions do begin. Because evening primrose oil tends to cause like a thinning of the cervix and a softening, there is some speculation that it could potentially cause PROM, which means that your water breaks before contractions begins because it's thinning the amniotic fluid sac. And there may be some concerns if you are a VBAC, so you're wanting a vaginal birth after C-section, with whether or not evening primrose oil could impact your C-section scar and maybe thinning it out a little bit more. However, if you've had any sort of like cervical procedures done prior to this pregnancy that may have caused some scar tissue, there is some thought if you take the evening primrose oil vaginally, it could soften up that scar tissue to make it easier for your cervix to dilate, because that could be something that causes like a stall in your labor where you're having really intense contractions, but you're like 1 centimeter and you're still 1 centimeter, still 1 centimeter. And then all of a sudden you're like a 9 or 10 because that scar tissue finally broke up. And so taking the evening primrose oil vaginally could potentially loosen up some of that scar tissue in theory.
So what is the recommended dosage for evening primrose oil? They recommend placing 1,000 milligrams like vaginally, which is quite a few capsules.
Or a
That's quite a
panty
few
liner.
capsules. So one of the like negatives of using evening primrose oil is one that you are going to have a lot more vaginal discharge, because as the capsule starts to dissolve, the evening primrose oil is coming out and being released and, doing its work on your cervix, but like it can't just stay there. So it's got to come out. So yes, wear a panty liner because it can kind of stain your clothes, I think. It's an oil, so it's going to take a bit to come out. So wear a panty liner. Some people will place it before they go to sleep because they also are going to be in a reclined position, so it's less likely to just like seep out everywhere as you're standing. So that's usually the recommendation. Again, some people might recommend it doing orally. Research doesn't support that it's as beneficial, but it may be better than nothing if you don't really enjoy the feeling of it being placed vaginally. With taking it orally, though, it can cause like some GI upset, like nausea and upset tummies. So knowing that ahead of time. Really oily panty liners or upset tummy, which one would you prefer?
But also taking it orally doesn't do anything, so panty liners, I guess. You can also not take it at all. It's not a mandatory thing in order for your labor to happen or to progress. The most common recommendations that I see of when to start taking evening primrose oil is usually around like that 36, 37 week time frame. But as with any sort of supplement that you take, it's really important to talk with your provider to understand what their opinion is on about it and what their recommendations may be for your personal situation.
So evening primrose oil research does support that it can soften and ripen your cervix. If you know you're going to be induced, it can be beneficial to try to make your induction hopefully easier. If you have previous cervical procedures, you can use it to hopefully break up any scar tissue prior to labor starting so that maybe that beginning of labor is a little bit easier.
Some of the risks that could potentially be involved with evening primrose oil, because it is a thinning type of oil, it could maybe cause your water to break before you have contraction, known as PROM. And if you've had a C-section prior to this pregnancy, there is some like concern as to whether or not it could impact your C-section scar. So again, it could be really important to talk with your provider if this is an option that you're wanting to explore. If you use evening primrose oil during your pregnancy, be sure to comment below to let us know how it helped you, whether or not it did or not. Maybe it didn't do anything for you at all other than give you oily underwear, but we would love to know how you were using it during your pregnancy. If you want more support throughout your pregnancy, check out our online prenatal fitness programs. Our online prenatal fitness programs are designed to help you stay strong and pain-free throughout your pregnancy and help you prepare for birth. Because one of the things that can really help to release more of these prostaglandins is maintaining an upright position as you labor, which fitness throughout your pregnancy can help to support you having the endurance and stamina to do so. So exercising will not make you better at labor, but it could help you move more, which could help facilitate your labor process a little bit more and help release more of those prostaglandins so you don't have to shove all these pills up your vagina. So check out our online prenatal fitness programs if you want more support physically throughout your pregnancy and birth.
If you're looking to prepare mentally, check out our online childbirth education, where we discuss the science of labor and birth to make it less scary as you enter into labor, as well as learn all of the different birth options, birth interventions that are available to you, and different labor positions and labor comfort measures that you can utilize during your labor progress. And you can check out all of our offerings on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our offerings. You can also bundle our prenatal fitness and our childbirth education together to pretty much make it free at 25% off.
So thanks so much for watching. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release new educational videos about twice a week and then new workout videos once a week.